Thank you for coming to this e-module on support for adolescents. My name is James Andrews. I use he, him, his pronouns, and I'm the Youth Care Team Program Manager here at the Department of Public Health. So the overview for this training and the learning objective for the e-module is you all are going to learn about the services provided by the Youth Care Team and how to connect any clients that you serve to these services. And this e-module is relevant to staff who serve families with young children because families who have multiple age children in the home can get support for their growing children as they transition through adolescence and young adulthood. And also some parents with young children may be teen parents and benefit from the Youth Care Team services themselves. So what is the Youth Care Team? The Youth Care Team, or YCT, is a program within the Maternal, Child, and Family Health Division of the Philadelphia Department of Public Health, and we provide client-driven programming for free, support youth ages 13 to 21 with a confidential, judgment-free, and safe space to talk about mental, sexual, and reproductive wellness and any needs that are associated with those areas of their health. So to go into a little bit more detail about what those services may include, mental health screenings for anxiety and depression. We can also help facilitate any referrals that are needed to talk to a therapist or psychiatrist, but we can also help youth work on coping skills to improve how they handle the ups and downs of being a teenager or a young adult. We also provide sexual health education, comprehensive sexual health education that goes into birth control, HIV, gender and sexuality, consent, how do they know when they're ready to be sexually active. We also help facilitate referrals to any services that could benefit their overall sexual health, such as getting on birth control, getting tested for STDs or HIV, or pregnancy testing, along with any other services. And we also provide short-term reproductive health counseling and talking with young people about what goals they have for future family planning and how best to align their behavior with those goals. And then again, we can refer out for any of those services that we cannot handle in-house. We also distribute physical resources such as internal and external condoms, oral sex protection, lubricant, finger cots, as well as other gender-affirming garments like period underwear or chest binders. We also provide comprehensive books on mental wellness and sexual and reproductive health, as well as journals and places that they can exercise the new coping skills that are taught in the program, as well as other swag items, t-shirts, stress balls, keychains, other fun things that we can use periodically to keep youth engaged in programming. So you have a client that you would like to refer to the Youth Care Team. We accept self-referrals by the youth themselves or any referrals from providers or parents in Philadelphia for any youth 13 to 21 years old. Providers can refer youth by completing the referral form online, which will be linked at the end of this presentation on the resources page, or you can scan the QR code that's available on your screen here. We also have stickers that can be sent to your site so that you can include them with any youth materials that you'd like to make sure that they have this resource available should they want to self-refer. We just ask that you please make sure to get any permission from your clients before referring them in, so that youth understand that you, provider or parent, have linked them with this program so they can expect our incoming call. And so what happens after you provide the referral for this young person? So a member of the Youth Care Team is going to contact the youth directly via the contact information and method that was provided on the referral form. Make note that we do reach out via text message if that is preferred. We could give a phone call, we could do a FaceTime or a Zoom, or we can do email. We also can do in-person meetups if being a barrier is that a young person doesn't have a phone or a way to easily contact us, or they would just like a more face-to-face in-person interaction. After that, our staff will inform the adolescent or the young adult about the services that are available to them in the youth care team program and briefly explain what confidentiality and youth rights they have around accessing mental, sexual, and reproductive health care so that they walk away with a better understanding of how they can be an active participant within these areas of their health care. Our staff will also provide any supplies as needed, such as condoms, lubricant, period supplies, journals, chest binders, any other necessary products that we have for distribution. And then we will also invite the adolescent to complete a universal health screening to determine the areas for support. So this universal health screening is what the behavioral health screening and the sexual and reproductive health screenings are included in. So our staff will also remain in contact with the youth and provide a warm handoff to any of the referrals that are needed, but also build out a support plan in which the responsibilities of the youth are outlined, as well as the responsibilities of the coordinator are outlined, and how we can work together to develop these goals around the health topics that we support and make sure that their behavior, again, aligns to that. And that is the training for the e-module today, the overview of the youth care team, and hopefully you have walked away with some new information and with a new support program to add to your tool belt with any adolescent or young person that may be in need of these services. If you have any other questions, you can contact me, James Andrews, from the youth care team at james.andrews@phila.gov. And please make sure to follow the link to complete a brief survey to help us improve this e-module, and you will receive a completion certificate.